Hello, everyone. My name is Abigail Seaver. I'm a naturopathic doctor in Ridgeway, Colorado, and I have been in practice for 21 years. I have a general family practice, but I specialize in balancing women's hormones, helping patients with their digestion, and treating autoimmune conditions. And we are here today to talk about the subject of perimenopause. So have any of you experienced any changes in your periods? So maybe periods getting closer together, farther apart, or heavier, or noticing spotting, or noticing that your sleep isn't as fantastic as it used to be, especially the week before your period. Any mood changes such as anger, irritability, anxiety, or even depression coming in for no apparent reason, feeling less tolerant of stress, noticing that your libido might be lower, worsening PMS with more bloating, headaches, breast tenderness, or mood changes, or even having hot flashes or night sweats. If you're noticing any of these things, you could be in perimenopause. So what is perimenopause? This is a time when your ovaries are still producing hormones, but your ovarian function is generally in decline. And it starts in your late 30s to early 40s and can last for 8 to 10 years until you completely stop having periods. So this time basically is when declining estrogen, progesterone, and testosterone levels can start creating some symptoms for some women. And some women notice dramatic changes, others really don't notice anything until they've completely stopped having periods. So progesterone is a big hormone in this particular situation because it does start declining in your early 40s and pretty steadily declines up until then, up until, your 50s and you stop having periods altogether. So progesterone is a hormone that's typically produced in large amounts in the second half of your cycle, which is called the luteal phase of the cycle. And as progesterone production declines, your periods may become farther apart. They may become closer together. They may get heavier, and you may have more trouble sleeping because progesterone is naturally a calming hormone. You may also experience more anxiety or irritability or worsening PMS. So all of these things can occur due to declining progesterone. And then during this phase, especially in your 40s, estrogen can fluctuate quite a bit. So even from 1 month to the next, estrogen may be high 1 month, it may be low the next. When your estrogen is high, you might notice that your breasts are swollen and tender, and you might be more irritable or anxious, and your period might be heavier. And then the next month, your estrogen might be low and you might be experiencing more low mood, trouble sleeping, vaginal dryness, and urinary changes. So estrogen can be really up and down through the 40s until it starts to steadily decline as well. And then testosterone plays a role as well. So testosterone is made in the ovaries also in smaller amounts than what men produce, but it does play an important role. And declining testosterone can cause low libido, low motivation, low mood, low energy, and cognitive difficulties and loss of muscle mass. So some women really notice a change in their testosterone levels as well, and symptoms associated with that. So how do you know that you are in perimenopause? Typically, we will know that you're in perimenopause because you are in the age range where it is typical to start seeing these changes. And then you may also have some of these characteristic symptoms. However, we can order lab tests. So we can order lab tests to check your ovarian hormone production. So estrogen, progesterone, and testosterone. And then we can also check pituitary hormones, such as follicle stimulating hormone, which can give us a clue as to whether you're in perimenopause or actually in menopause. So sometimes we will order lab tests to check those things. I wanted to talk about what potentially could make perimenopause worse. So there are just a couple of things that we know can make your symptoms worse during this time. And those would include sugar, so consuming sugar regularly, consuming alcohol regularly, having a sedentary lifestyle, and being under a great deal of stress. So it's widely recognized that alcohol and sugar can significantly worsen hot flashes, night sweats, mood, and sleep. And women seem to become more sensitive to the effects of these in this time, unfortunately. A sedentary lifestyle makes these symptoms worse because exercise actually really helps. So if you're not getting exercise, you may feel these symptoms more significantly. So exercise actually helps to relieve PMS. It can improve your sleep, and it can improve your mood and your energy level. And then if you are under a great deal of stress, your ability to make the appropriate amounts of hormones to keep you going through perimenopause may be diminished. So we know that the adrenal glands make a hormone called DHEA, which your body naturally converts into estrogen and testosterone. And you do rely upon this hormone as you're transitioning away from your ovarian hormone production to mainly relying upon adrenal hormones for your hormones. And so if you've been under stress for a long time, you haven't been sleeping well, you've had a big stressful event, your ability to put out that DHEA to compensate for low ovarian hormone production may be really diminished, and you may have more significant symptoms in perimenopause and menopause as a result. So I know that some stressors can be controlled, some can't, but working on stress management and taking good care of yourself during this time is really, really important. So are there any health risks associated with being in perimenopause? So there are a few. So we know that lowering estrogen levels often does result in decreased bone density. And while we may not see that specifically in perimenopause, the process does start in perimenopause. So the density of your bones starts decreasing in perimenopause as estrogen starts to decline. And then we also know that women, by the time they're in menopause, are at increased risk for heart disease. And that probably does have something to do with a change in our hormone levels. So what are some lifestyle measures that we can take to address perimenopausal symptoms and just stay healthy during this time? Just generally eating a healthy diet consisting of vegetables, fruits, beans, nuts, seeds, whole grains, and lean proteins like poultry and fish is a fantastic starting point in terms of diet for this time in life, and also during perimenopause or during menopause. I recommend, as I mentioned previously, that you exercise regularly to help maintain your bone density, but also to improve your sleep, your mood, and your energy levels. And then I recommend quitting smoking if you smoke, because smoking will increase your risk of osteoporosis, so thinning bones, and also heart disease. And the risk for those naturally goes up in menopause anyway. I recommend that you limit alcohol and caffeine, both of which can make these symptoms, all of these symptoms worse. And I recommend, as I mentioned previously, that you figure out some strategies to help manage stress. So things like meditation, yoga, gentle stretching, spending time in nature, walking, hiking, camping, whatever you enjoy doing that helps you to feel calmer and less stressed is a huge benefit. And you'll find that you may even need to employ some of these techniques more during this time of life. So there are some pharmaceutical medical treatments for perimenopause, and those primarily consist of birth control pills. So if you were to see your primary doctor, your medical doctor, they might prescribe birth controls pills for you at this time of life. Sometimes hormone replacement therapy is prescribed. And then antidepressants and nerve pain medications are sometimes used medically to treat perimenopause. And so if you were to see your medical doctor, these would be the options that would be offered. And so what I do is a little bit different. So I like to focus on diet and nutrition. And then I use natural therapies such as herbs, vitamins and minerals, amino acids, fatty acids, homeopathic remedies, and I will prescribe low dose hormones in some cases as well. But I like to do this as naturally as possible. And so some kind of general perimenopausal diet and lifestyle recommendations that I would have for you to try that would be safe for virtually anyone would be to start incorporating some phytoestrogen-rich foods into your diet. So in addition to that general healthy diet that I just mentioned, the phytoestrogen-rich foods are foods that contain a compound that can partially bind to your estrogen receptor sites and exert a mild estrogenic effect. So these foods don't contain estrogen per se, but they contain a compound that is similar enough to our estrogen that it can exert a mild estrogenic effect, and that can help to relieve some of your perimenopausal symptoms. So the foods that are richest in the phytoestrogens are ground flaxseed, soy, so organic soy such as tofu, tempeh, edamame, miso. These are all sources of soy, and I recommend buying organic in that case. Also other types of beans. So soy is a bean, and other beans do contain phytoestrogens. Sesame seeds, almonds, broccoli, Brussels sprouts, and kale also contain phytoestrogens. So I strongly recommend incorporating these foods into your diet because they actually will reduce some of those perimenopausal symptoms. I also recommend including healthy fats. So things like nuts and seeds and olive oil, wild fish, and avocado. So the reason for this is that hormones are made from cholesterol, and we actually need some cholesterol in order to be able to make our hormones. That's the building block for our hormones. And we want to provide more healthy fats as a substrate to make our hormones. Those healthy fats are also anti-inflammatory and can reduce some of the perimenopausal symptoms. In addition, there is a strategy called seed cycling that is used to regulate menstrual cycles, especially when they're starting to become irregular or your cycles are coming too close together. That can help to make those periods come more regularly and also lengthen out the cycles so your periods are not so close together. And the seed cycling regimen, it consists of eating 1 tablespoon of ground flaxseed and 1 tablespoon of pumpkin seed days 1 to 14 of your cycle. So day 1 is the first day of your period. And so you would start those seeds the first day of your period and continue them for 2 weeks. And then you would switch over and start eating 1 tablespoon of ground sesame seed and 1 tablespoon of sunflower seed. So you would continue that for 2 weeks as well, or up until you get your period. And the seeds are rich in fiber, they're rich in protein, and they are a source of healthy fats. And believe it or not, they also do encourage your body to make appropriate amounts of estrogen in the first half of your cycle and appropriate amounts of progesterone in the second half of the cycle. So that's a nice nutritional strategy if your periods are starting to become more irregular, or they are coming too close together or too far apart. Additionally, there are a couple of vitamins that I suggest that are safe for virtually anyone, that can be beneficial in terms of addressing perimenopausal symptoms. And those include a B complex, so a vitamin that contains all of the B vitamins together, a vitamin E supplement, and then omega-3 fatty acids. So all of those nutrients have been studied for the treatment of perimenopausal and menopausal symptoms, and are safe non-hormonal approaches for almost anyone. Other things to consider would be acupuncture. So acupuncture is a treatment that is doesn't involve taking any pills or hormones, but can be very instrumental in really significantly reducing symptoms in perimenopause and menopause. And there are a number of great acupuncturists in our area that could help you. I also think about supporting adrenal function during this time, because as I mentioned previously, the adrenals, if they have been subject to either prolonged or acute stress, or prolonged sleep deprivation, have trouble producing enough hormones for you to smooth out this time in life. And there are vitamins and herbs and other treatments that can help with adrenal support. So these are just some things to think about that you can incorporate on your own that would be safe for virtually anyone. And then what I do in my practice is I help women who have trouble beyond this. So if you are still struggling, you're eating a healthy diet, you're exercising, you're meditating, you're taking your vitamins, you're doing all the right things, and you're still experiencing bothersome symptoms of perimenopause, that is where I come in. So what we would do would be to schedule an appointment. We would sit down and talk about what's going on. And then I might order some tests to take a look at your hormone levels and see where things are. And then I would prescribe a treatment. And so my treatment, as I mentioned before, could be one of the many herbs that I use in this situation, or a combination of herbs. It might be low dose hormones, it might be a homeopathic remedy, or there may be other suggestions that I have for you. But if you are struggling with perimenopause and you feel like you're already doing the basics and you need more help, then I would love to help you. My phone number at my office is 970-626-3188. My email address is abigailseaver1@gmail.com, and my website is drabigailseaver.com. So I invite you to get a hold of me if you feel like you need more help with all of this, and I would love to help you. So thank you everyone for attending. I really appreciate you watching this little webinar, and I hope to see you soon.